There's me. I think we're fixed now.
There we go.
I cannot believe I did that. Oh,
That's
just,
okay.
I was just trying to stop it from going over there and all of a sudden being, like where you can't correct anything because sometimes when you do that,
Right.
like it just goes straight over and people are watching it before you can even clean up anything that might be
Yep.
wrong
Now,
with that.
now it's
It's fine.
showing. Now it's
Good.
showing. Now I see it.
Right, good.
Okay, good. At least we figured it out.
Yeah, at least we got to have a good talk before we started.
Yeah, that's good.
That's
Yeah,
okay.
right?
Oh my God, so funny.
That's
I
okay.
just laugh at myself. I always do laugh at myself. I mean, what the hell, you know?
Yeah, no, that's fine. We gotta figure it out. Better late than never. We gotta. I like the little border you put on. It's really cute.
Thank you. It's part of those little. They had this little thing on StreamYard, and every once in a while they'll update these
Mhm.
little things that you can just pick from. And I thought, oh, I like
Yeah,
that.
super
One.
cute. I love it.
Yeah. And I wish we weren't black. I don't know why we're black, but we are black, and that's okay. I guess that's fine.
Yeah.
Okay. So, and we were going to talk about these dirty little secrets known as hoarding and how it's really never talked about. I mean, you see hoarding on TV, but in families that have that issue, it's really not talked about. It's really
No.
like they just try to hide it. Like they know grandma's a hoarder, but they ignore it. They just don't go to her house. She comes to their house or whatever.
Right. Right. There's
Then,
they work. The people who do it work around it. I mean,
right?
I don't know. I used to watch that show Hoarding. I don't know
Hmm.
if you ever watched it.
I did
And you
watch it.
know that some of those people are professionals, they're career people. You would never know by looking at them the state of their homes. You
No,
would
you
never know.
wouldn't.
And they just learn to navigate around it.
And it's hard to imagine. I mean,
Mm-hmm.
a lot of it, we've kind of talked about this a little bit before, but like some of it comes from trauma. Some of it comes from other
Mm-hmm.
mental illnesses that they've had all their
Mm-hmm.
lives. Some of it is, like they talk a lot about people that have attention deficit, usually, or most of the time, will end up being hoarders as well.
I've never heard that till you told me
Well,
that. That's so
when
interesting.
it is interesting, is because if you think about how their mind works, they don't finish anything. So
Mm-hmm.
you're kind of like over
Yeah.
there doing things and you just stop in the middle and go do something else, but you don't go back and finish it. So
Mm-hmm.
that is another thing that happens. But now a lot of it is also from trauma based. We kind of talk about that
Mm-hmm.
too. Um, as far as and some people, I noticed that some people, even from the hoarding shows that we've watched, talk about, oh, well, when they were a child, they went through the Great Depression and they didn't have anything. So as they grew up and could afford to do things for themselves, they made sure they would have it. But the problem with that is by the time they're needing to use it, it's already eaten up by rats or it's,
Right. It's
outdated or
destroyed. Right. Exactly.
destroyed. And it destroys their homes too. And then,
It does destroy the homes.
and
Mm-hmm.
it's like, what do you do when all of a sudden
Well,
you hear grandma?
it's when
Yeah,
it's so severe. I mean, I can't imagine being in that position when it's so severe. It's like you wouldn't even know where to start. Like
yeah.
you wouldn't even know where to begin. You would literally have to get rid of everything you owned. Everything. Everything.
And that's hard for those people, you know?
Oh yeah.
I mean,
Yeah, I can't imagine that. It's got to be a horrible way to live. Horrible way to live. And you know damn well, nobody wants to live like that. You
no, I
know,
don't, no, I don't
nobody
think
wants.
so.
Just the same thing with the drug addict. Nobody wakes up and says, "I want to be a drug addict today." Nobody wakes up and says, "I want to be a hoarder for the rest of my life." They just don't know how to fix it.
That's what I think
And
too. I mean,
I think the counseling and stuff that's required to get out of that has got to be really intense. It has to be.
can you imagine though? I mean, when you look in and let's say you're looking for a telephone number or somebody to try to get some help from them. There is no number that says, okay, if you're a hoarder, call us, right? If you need mental help because you're a hoarder, call us. That's just not out there.
Right.
It's like they
No.
don't know people are hoarders until they get down to the, I guess, talking. I guess
Well,
it's do
tell
that in
the
therapy.
I'm sure by the time it's found out, it's so
Mhm.
severe. You
Right.
know, it's so severe. I would imagine most nearly 100% of these cases that when it's discovered, it is beyond it's beyond. Like you say, the home's destroyed, all their properties destroyed, everything's destroyed. And can you imagine the financial burden on because you are a hoarder, because a lot of them have addiction to shopping and
Oh
purchasing
yeah.
and buying, and then the recovery process of that, the financial um,
I should
repercussions of
make us
that are
bigger.
just incredible,
Oops.
incredible.
I need to fix us. We're too small. I gotta fix us. We're too small over here. I don't think people realize we're here. I don't know. Let me see if I can fix this
Uh-oh,
while we talk. But
that's
you're
better.
right
You got it
about
better.
that's a little better. Yeah, you are right about that.
Yeah.
So let me see if I can find it over here. We can do two people. Let's see. This is
I mean,
close.
can you imagine having to replace everything in your home, like just like if you had a fire or a flood or something in your house, everything down to your toothbrush and toothpaste, how much
No,
that would cost? I mean,
no.
toothbrush, toothpaste, socks, pajamas, shampoo, conditioner, body wash. I mean, every single thing that we use on a daily basis to
Right?
replace all of that, the cost
It,
of that alone is astronomical.
I mean, yeah, it is.
Even if you're just getting minimal things to live on, to start over, quote unquote, the cost of that is just out of this world.
And by the time that these people are discovered, really, they spent all their money and they're in this
Mm-hmm.
horrible living situation, and they
Mm-hmm.
absolutely. I'm going to show you something from 6 years ago, and we're going to talk about it. Okay, so hold on a second. Right now, I got whoop, hold on. I got to share a screen and all that. I got to turn it down. Let's see. Share a screen. Let's talk about it for a
And their
second.
relationships with their family, friends are
Yeah,
destroyed. I mean, it
really
destroys
bad.
everything. It's no different than alcoholism, drug addiction. It's no different than that. It's destructive and destroys everything.
Look at that little circling shit happening. Okay, that's my.
Uh-oh.
Yeah, don't do that. Oh boy, I'm telling you, I'm telling you. My God, why? Anyway, oh there it is. Okay, so let me fix this part. We'll just watch this for a second and here. Let me start it. Okay, now I think it's way too
decade
loud. I
than we
might have to
used to.
turn it
We're
down.
starting to understand some of the cognitive factors associated with hoarding, like problems with attention, as well as the beliefs that are associated with the disorder. We're noticing that with a lot of people with hoarding, they have some social difficulties. They might have difficulty connecting with other people
Oh,
or
I need to
report
put a
being
little.
quite lonely. Other people with hoarding describe some problems with their cognitive functioning, problems with their memory or attention that contributes to the disorder. And finally, common across people with hoarding disorder tend to be certain kinds of intense emotional attachment to possessions. We do have some treatments that are for hoarding disorder. Some elements of those treatment include cognitive strategies to challenge some of the thoughts and beliefs that are associated with hoarding, as well as exposure to discarding and decision making. So increasing people's ability to tolerate those negative emotions and stop avoiding, and help them to discard their items and organize them. We have some concerns about the KonMari method for people with hoarding disorder. Others find it quite helpful, but some of her advice to keep things only that spark joy. People with hoarding demonstrate attachment to a large number of items, and that can be problematic for them.
Think about what she said. Things that bring you joy. Think about only keeping those things. But the thing is, the people that hoard these things, that all brings them joy. That's why they hoard it.
Everything brings them joy. Exactly.
It
Exactly.
kind of doesn't really make a lot of sense, does it? That's kind of strange that she would say that, but
Yeah,
okay.
trash brings them joy. I mean, everything.
Now some of them, are just damn lazy. I don't understand why somebody would throw anything down on their living room floor and then just walk across it like they didn't see it.
Yeah,
That's
I
just
find that hard
disgusting.
to understand too.
Yeah,
I find that hard to
that's
understand as well.
laziness. But you know, um, well, I'm gonna let this play through, and then we'll bring up the other thing that we were going to talk about, which is how it works with attention deficit and those things. Here we go.
Also, sometimes people with hoarding tend to anthropomorphize things, which means they imbue them with human qualities. So sometimes some of her strategies might exacerbate those tendencies.
Yeah. Okay, go back to the other one. Oops. All right. Ooh, how do I get back over there? Stop sharing this one. I'm gonna stop sharing that. We'll bring in the next one. But you know, And she's right. They do put some human qualities to it. But most of those people are extremely lonely people. And they've
Yes.
already alienated everybody else in their family. So these things
Hmm.
just become like their friends or their, like people
Right.
who hoard dolls.
It's their companions.
Yeah. I mean, it's hard for us to imagine because we could never do that. So we kind of don't
Hmm.
really understand it. Um, now I kind of mentioned this before about how hoarding and attention deficit are strongly linked. Now but this is true. It's not made up information. You can find it out there on the internet yourself. Um, the core issues, especially the inattention to executive dysfunction and its impulsivity, make it difficult to discard items, leading in many individuals with ADHD, with some studies finding that up to 20 to 30% of adults with ADHD exhibit hoarding behaviors. And that
Oh
makes a lot of
wow.
sense. Yeah. This connection stems from the shared challenges with the decision and making and organizing from starting and finishing tasks. Memory and inattention to often being a key predictor of hoarding severity, suggesting that routine screening for hoarding in ADHD patients is important. And I think that's right. And I think, when you look at these people, now people with severe ADHD, I know people will always say, well, that's my attention deficit or whatever. We're talking about the level of attention deficit where they cannot make it through the day finishing one thing, nothing.
Yeah, they cannot make one decision about one thing.
Right. And it's out there, and that's a big problem. The connection explained is the executive function deficits. Both ADHD and hoarding involve difficulties with executive functions like planning, organizing, and task initiation, making it hard to manage possessions and declutter. So there's a lot of inattention, that poor focus and distractibility just makes it difficult to complete sorting or cleaning tasks, while also contributing to this disorganization and the clutter accumulation. I mean, I can kind of see this. Then there's this
Yeah.
impulse. I mean, attention deficit people have a hard problem. They're just very impulsive. And it's just
Yes.
impulsive buying or acquiring new items just exasperates the problem. Then there's that emotional attachment that she kind of talked about. Difficulty discarding items often tied to a perceived need to save them and to stress about letting go. Problems exacerbated by ADHD related emotional dysregulations. So
Yeah.
that is kind of a hidden problem here. They don't realize, people with ADHD, they don't realize their clutter is significant, or they may not disclose it despite it impairing their daily functioning. Like a lot of them can't even pay their own bills. They can't even cook for themselves. They just they just get up and their world is different every day from ours because we can't think like they think. Um,
Yeah.
there's a statement that says clinicians need to routinely assess for hoarding in these patients, and ADHD research should include more individuals with hoarding. I agree with that. That's something that they
Hmm.
don't talk about. It's another one of those little dirty secrets. They don't talk about these people, 20 to 30% of them having that strong, but only maybe 20 to 30% of them are at that level of ADHD. That's
Right.
what we don't know. So let me go pull this other thing up. Here we go. I don't know. It's kind of a situation that I never really thought much about myself. Oops, here we go. Come on now. All right. What is it doing? I wish my damn thing. Okay, here we go. Hoarding disorder now. Let's see. Now, this is from the Mayo Clinic, and this is 7 years ago. And this is a doctor that's going to talk about actual hoarding disorder. And his name is Dr. Craig. Hang on a minute. Dr. Craig Shawshank. I know I'm not saying this right, but anyway, he's going to talk about that hoarding disorder. And here we go. Let's see. Play. Oh, I got to share my screen. Here we go. Okay, share that screen. Here we go. Yeah,
Hoarding disorder. A person with hoarding disorder experiences distress at the
there we
thought
go.
of getting rid of items. That sounds rather familiar.
Oh.
Hoarding ranges from mild to severe. In some cases, hoarding may not have much impact on your life, while in other cases, it seriously affects your functioning on a daily basis.
playing with fire here, Dr. Kakar. People with hoarding disorder may not see it as a problem, making treatment especially challenging. Here to discuss treatment for hoarding disorder is Mayo Clinic psychologist, Dr. Craig Sawchuk. Welcome back to the program, Dr. Sawchuk. It's great to see you again.
Great. Thank you for having me.
Before you got here, we were saying I used to love the show Hoarders because it made me feel better about myself. And then I realized, oh, wait, these people actually have a disorder. So no, I don't like watching that show anymore.
Yeah, it's a pretty tough show. I mean, it's in the era of showing some mental health issues on TV, and it shows the reality of some of the impairments and living conditions that these folks go through. I have some qualms with exactly how the program dealt with the treatment aspect of things, but I'm hoping we can clarify some of that today.
So, what makes it obsessive compulsive disorder?
Yeah, actually, originally, from a diagnostic standpoint, it was embedded within the obsessive compulsive as a variant of obsessive compulsive disorder. But however, the phenomenology and the symptomatology of hoarding is actually different than OCD. Hoarding is actually more common than OCD, that it feels less ritualistic than you would see with OCD. And then also with traditional OCD, they have obsessions about thoughts that really cause them a lot of distress and that they fear. Whereas with hoarders, when you think about acquiring things and holding on to things, there's more of a positive affect, with that, the desire to hold on to these things rather than the fear that goes along with it. So in the DSM-5, which is the latest iteration, they've actually separated out hoarding disorder and stopped calling it compulsive hoarding.
So Dr. Sawchuk, we all collect things. I like to collect things, and I didn't think I had a particular disorder. When does that become a problem for people?
Yeah, there's really two markers that show up for this. This is actually one of them is, and this is the only one, as far as I know, in the DSM-5 that signifies this, is that when an actual living space becomes functionally impaired, so it cannot be used for its intended purpose. So we think of a kitchen, it's where we prepare food. And if the clutter is getting in the way of it's piling up on the counters, across the stove, getting in the way of the kitchen table, so where a person can eat, a bathroom that becomes so cluttered you can't use it to be able to go to the bathroom. That's one thing, when the impairment in the living space for its intended purpose. The second is functional impairment with the individual, and this can happen with social relationships and breakdown in social relationships, conflicts, inability to sustain a job, go into work, or depression from isolation that can occur.
Speaking of depression, do hoarders have other mental health issues that go along with hoarding?
Yes, it's actually more common than not, and this is again another differentiation between OCD and hoarding, that it's in fact much more likely that hoarders will have a comorbid depressive disorder as opposed to another anxiety disorder, which the reverse can actually be true for traditional obsessive compulsive disorder.
So what are the risk factors for developing hoarding disorder?
Yeah, there's a few different ones. One, we can think about biologic risk factors. We know that hoarding does tend to run in families, and it may not be the full condition of hoarding, but sometimes the traits towards being a pack rat and collecting and having difficulties discarding things. But there definitely is a larger proportion with genetic influence there. It tends to run in first-degree family members. Secondly, is that we think of environmental risk factors. So this could be isolation. This tends to happen in private. So it's...
Think about that. It's like almost like it's inherited or something. Like there's this, it tends to run in families. And then, I mean, that's, I'm going to try to think back if I know anybody else who had a hoarding problem that also their grandmother or somebody in their family had that I've ever known. And I mean, I don't, but when we did watch Hoarders, I believe we saw shows like that. Remember, did you remember the one where it was the three brothers and all three brothers had hoarded up messes?
No,
Okay. And I do like what he said about he doesn't like how they approach some of these on that show, because
yeah.
I don't either, because a lot of times they embarrass them really bad. And basically, even though they said it was up to them to throw away whatever they wanted to throw away, they just gave them so much hell that they had no choice but to throw it away, right? So I don't
Right?
really think that that was fair on their part. But I do like where he's
Yeah.
going. It's
Too overwhelming.
it is. I mean, you got to put yourself in their place, which I know is hard to do because we don't fully understand it. But
Yeah.
he's going to talk about the mental illness that comes with it, and I'm hoping that they and then notice he's talking about isolation, and that's the next thing he's going to talk
Yes.
about, the isolation. That is part of that mental illness. So we'll let him keep going, but it's very interesting their take on this. Here we go.
Mm-hmm.
Typically, this condition goes on for a long period of time before the impairments come to light, or even like family members or close friends even see this. So just the nature of how this can fly under the radar, it can happen. Then there's also more psychological things that can be risk factors. Trauma history can be common among these folks, and even loss. And in many cases, that folks can identify a particular point in time where the hoarding just kind of flared up. One other factor that is important too, and this is kind of the nature nurture thing, is because it runs in families, sometimes it's modeling. People learn that everything has value, can be used at some point in some time, don't be wasteful. And when that's modeled to you, you carry those things forward.
I think it's interesting that, as we said in the introduction, a lot of people who have this hoarding disorder don't think it's a problem. So if there's, something else like anxiety or depression where you can't see it, with hoarding, you can see it. The evidence is right there. You can't move around your home like you used to be able. Why is it that people who are hoarders can't see that it's a problem?
Yeah, there's really three big things that go on into the types of symptoms that we see in compulsive hoarding. So one is difficulties with information processing. So they have difficulties with attention, concentration, organization, and decision making. So sometimes that leads to not necessarily being aware of a problem. I'm just messy, just a little disorganized. Secondly is problems with their beliefs. So they have what's called a double-barreled reinforcement, that they like doing what they're doing. They're interested in like acquiring things. It's the thrill of the hunt, or I could really use this for some reason in some way, or boy, this person will really like this and it feels good. And sometimes they do the behaviors too to make themselves feel less bad if they're really stressed, mourning the loss of something. This may be a thing that they do to feel less bad. So there's a double-barreled level of reinforcement where they don't notice it, and they see things differently than we do. So this could be used in some way someday, or this is so unique and different. And then there's problems in behavior, and that's where the avoidance, comes into play, where they realize that they've got clutter and it can cause them problems in life, but they feel too overwhelmed to deal with it, or I'll just deal with it later, kind of idea, putting things off. But then the thrill of the hunt and the acquiring, so doing too much of some kind of behavior, again, it serves a purpose, and it tends to elevate the mood, and at the same time kind of put aside some difficult emotions.
I think this is fascinating, Tracy. I'm sure we all have a degree of hoarding. So, Dr. Shawshak, if you have this disorder, what can you do to treat?
Stop and talk about this for a minute. Fair use and all that, but wow, think about what he's just saying. It's almost like people who self-medicate with illicit drugs. They're self-medicating with shopping, just that impulsive shopping, because it makes them feel better for however long it makes them feel better. That's what it seems like over here. It would still be horrible to be trapped in that cycle.
No, I can't even imagine.
I think it would be like a cycle of the never ending hunt.
Oh, yeah.
But I wonder. I always want to wonder, and I always ask this, and it's really about anything we talk about, whether it's crime or this hoarding, whatever it is. I always want to know what happened in this person's life that caused them to do whatever it is they're doing. Because even this is self-medicating. I mean, are people who take out other people, are they self-medicating? I mean, I don't know. I really don't know how to explain that, but it seems to me like it's like they use this. And they're always going to have some excuse for it, right? Well, especially the narcissists. But how many? Think about this. How many of these hoarders are actually narcissistic as well, or actually sociopaths or psychopaths as well? I would think that some of them actually are, I believe
Yeah.
that. I don't know that, but we'll find out. So let's go back and see what he has to say. It's an interesting subject, and it is sad.
It's
Yes.
very
But what
sad.
should family members do?
Mhm.
Yes.
Yes, well, family plays a huge role in this. And this is actually something in my entire career
Where's my
of
friend?
working in mental health. This is the condition that in my books
Where'd
is
you go,
the most
Sprinkle?
challenging to treat,
Wow.
but also the most rewarding to treat because you can really make some good progress. The trick is getting plugged in with the right system of care. This is a systems-based
Sprinkle
approach.
fell
And I
out.
think exactly, you mentioned the word family. We have to have family and functional friends, I should say functional family members and functional friends involved because you really need a team. It's
Well,
a team
having them
approach.
just come and clean everything out doesn't work either because then they just continue hoarding.
Exactly, because the clutter in and of itself is not the problem. It's a manifestation of what the
Sorry.
problem is, which
Yeah, I
is
don't know what happened.
difficulties with information processing. So it's very practical strategies we teach people in terms of organization, decision making. We also focus in on the difficulties in their thinking and learning how to challenge those acquisition beliefs right in the moment. And then also working on very practical decluttering exercises. How do you sort into categories? How do you use your living spaces for that logical capacity that they have for items? But you really do need a team approach, and it is a longer term treatment. Another absolutely essential component of treatment is doing the therapy in home. So you're actually physically in their environment, working for those things. And it's actually, in all honesty, it's been a challenge for mental health providers to be able to do that because sometimes liability reasons, they don't want you going off site into a person's home. And for billing reasons that you may not be able to bill for your services outside of that.
If people recognize that maybe they need to seek help.
Listen to what they just said. They can't go off site to help them for billing reasons or liability
That's crazy.
reasons.
That's
How are you
crazy.
helping them then? If their house is boarded up, not your office, when they come in there to talk to
Right?
you, I mean, you need to see what they're living in. You need to have some kind
Right?
of support services that works with the medical field to go out there and to help them. And I'm not talking about the show Hoarders because that's completely different. I mean,
Right. That's
it is
commercialized.
it is commercialized and it brings it to light, but it also, I think, kind of mentally affected these people as well because you put their business out in the street. It's on TV forever. It's not like they just take the episode off and then people don't see it again. And if you go
Right.
back and check on these people, most of them have rehoarded up the place that you just cleaned out.
Oh, yeah. Yeah, the large majority.
Yeah, so they really learn nothing. They don't know how to help themselves, and it's like everything else. It all comes down to money, doesn't it? We'll go ahead and finish
Yeah.
listening to this. Golly.
What should they do?
Contact their local primary care physician may be the first place to start to be able to look at what resources are available. I often find county social workers actually might be in a great position to be able to identify what resources are available in the community.
We've been talking about hoarding disorder with Mayo Clinic psychologist Dr. Craig Sawchuk. Fascinating. Thanks for joining us today, Dr. Sawchuk.
Great. Thank you again for having me.
Okay. I'm going to go find us another one to listen to, but yeah, that was kind of interesting. I mean, I would have never thought of it like that, right?
Yeah.
Now, here's
Yeah.
something from 7 years ago, and it talks about, and this is from the International OCD Foundation. It's going to talk about why people with hoarding disorders hang on to these objects. So here we go. Okay.
So all of us enjoy having objects that bring meaning and joy to our life. Individuals with hoarding disorder are no different from all of us. We have three main reasons that we keep objects. So one is sentimentality, something that reminds you of a happy time or a loved one. The second is the aesthetics. Walking along the beach and seeing a beautiful seashell, you want to take it home and remember the beauty of the day and the object. And the other is the usefulness. So I don't want to throw this away. It could come in handy someday. Now, individuals with hoarding disorder have these same reasons, but they're magnified. So objects may have all three of these reasons, or the feelings may be more intense. And that's really where the attachment comes in and the difficulty parting with objects. Individuals with hoarding disorder are very creative, and they can come up with lots of uses for a particular object. And, had clients where something as simple as a toilet paper roll, they could use it for binoculars for a child's science fair project. It could be donated to a local school. An art project could be made out of it. However, one of the differences that distinguishes an artist versus somebody with hoarding disorder is that those ideas are not fulfilled and realized. So when you ask somebody with hoarding disorder, they don't have plans to donate it to a school. They don't have plans to make an.
I want to think about what she just said. Donating a toilet paper holder to a school. Now let's think about this logically. Most of us would never donate anything like that to anybody because of where it came from. You got to think about this. You wash your hands afterwards, right? Not before. You wash your hands afterwards. You've touched this. You're not washing your hands and then touching the toilet paper. You know what I mean? It just seems like that would be just really disgusting. That has no place to be donated anywhere, actually.
No.
It should be recycled. I can see that, but not donated. But I understand what she's saying because these people, well, there was one episode where the lady, everything the lady touched, she saw value or some way to reuse it. I mean, it's just like that. That's their logic. But wow, I mean, think about science projects and think about these things kids bring to school and then think about what it's made out of. I never really thought about this before until she just now said it. It's kind of yuck.
Yeah.
An object, they may have plans, but they don't actually execute on that. One of the things I would say about hoarding disorder is that it stems from some characteristics deep within us as human beings that are actually positive. So wanting to be conserving resources, and throughout the evolution of man, it's been important in times of relatively few resources to gather resources, and it's been very adaptive. But as time has gone by with industrial revolution and also a lot of advertising, we get more and more pressure that taps into that fundamental need to save and conserve resources.
Among the things.
This is part of, yeah, it is. Hang on a second. There we go. And this is the next one. This is going to be Randy Frost, PhD, and he's a professor in psychology. So here we go. Oh, I forgot to let him play. Here we go.
That we think are part of the cause for hoarding behavior have to do with the way in which people process information. And we think that people who hoard process information in several unusual ways. One of them has to do with the nature of things they pay attention to. People who hoard pay attention to the unusual detail in objects, like the shape, the color, the texture, and so forth. And they don't necessarily have the same view of these things in terms of what is the most important feature. For instance, of a bottle cap. You can focus on the shape and the color and the texture and maybe give it value because of that. Or you can focus on the fact that if it's a bottle cap without any bottle associated with it, maybe it has no useful function. One of the things that is related to why this develops, we think, is the way in which information is processed by people who have hoarding problems. Attentional problems are one feature of this, where there's a tendency to focus on the unusual detail of an object, and that gives that unusual detail more value.
Hang on a second, guys. Let's see how much. Let me see. All right, here we go. Sorry.
Another characteristic has to do with the way in which we think about objects and the way in which we organize our lives. Most of us organize our lives categorically.
Oh, sorry.
So all of us.
Hang on a minute. I didn't mean to do that, but okay, we'll just find the next one. I'm so sorry about that. But we're going to watch this right here a minute for a second. Now,
individuals who are struggling with hoarding disorder are caught up in the stuff, if you will. We start to find that there's what's called goat paths, where people are trying to maneuver their way through hallways and into various rooms. Hoarding disorder is an anxiety disorder, and it's marked by individuals who struggle with excessive acquisition of stuff. Where this becomes a problem is that they cannot discard the items. So their house begins to become filled to a point where there's areas in the home that cannot be accessible. The house gets so overrun that people start putting things wherever they can. They can't sleep in their bed. Oftentimes they can't sit on the couch. They can't socialize, and they become very embarrassed and very ashamed and very isolated because of this. It is estimated that approximately 19 million Americans are struggling with hoarding disorder. I believe these statistics are highly underrepresented because there are so many people that are suffering.
You know what? I agree with her because again, this is a silent. My dog's gonna bark. I'm so sorry. This is silent. You know, people don't talk about it. They just don't talk about it.
Yeah,
So,
they don't.
it's a shame too. I mean, who you don't grow up telling your children now, be careful, don't be a hoarder. You know,
Right?
They don't even know what that is until they go to grandma's house and they're like, Mama, how come we can't go visit grandma? Oh, because there's no place to walk. Why is there no place to walk? Oh, because she's a hoarder. I mean, terrible. It's just terrible. So, you know, I wish my dog would stop that barking. But he's not going to, is he? I don't know what's out there.
Yeah.
We'll just, for a minute, we'll just let him bark. Here, I'm going to be quiet and you just talk. Well, I'll be quiet since he's barking. You talk.
Yeah, it's just tragic. There's so many layers to this. It's just not a quick fix. There's so many layers to it that need to be addressed before this issue is going to get under control. And I'm sure
Welcome to my scientifically informed insider look at mental health topics. If you find this video to be
Okay, he quit barking.
I'm sure the families don't even begin to know how to deal with this, you know?
Well, yeah, I mean, I'm sure they don't because again, it's not something you never taught this. It's like I don't ever remember hearing about this period until I saw it on TV one day, and it was the show about the hoarders. Never. I've never. I mean, I don't know who has. I'm sure. I'm sure kids have grown up with this somewhere. We know they have, but yeah, they don't teach this anywhere. Nobody's just like, you know, in school, you're taught about everything that could go on in life, but nobody says, "Oh, well, don't grow up and be a hoarder."
Right?
Maybe they should talk about that. Maybe they should talk about, but the schools cannot be mental health. They can't teach mental health either. That's a whole different. It can't be part of an everyday scholastics. It can't be part of school. But you know, it is hang on a minute. Let me see who this guy is. I forgot. This is a disorder. This is a case study in hoarding. And this is Dr. Todd Grande, and I love listening to him. We've listened to him before. So here we go.
interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question asks if I can analyze a case study involving hoarding disorder. So a case study or a case report is completed when a counselor wants to document a client's course of treatment, right? So what the symptoms were and how the treatment progressed, things like that. This is done with the client's consent, and details are changed to protect the client's identity. Case reports appear in a variety of places. The one I'm using for this video was published in a journal, and I'll put the reference to the article in the description for this video. So first I'll talk a little bit about hoarding disorder, including going over the definition, and then I'll take a look at this case study. Hoarding disorder was first introduced as an official mental disorder in 2013 with the publication of DSM-5, Diagnostic.
This is why we don't know about it. It was not introduced until 2013. That is when it was starting to be discussed. That is the reason why we don't know. This is good information. Here we go.
And Statistical Manual, version 5. Before that, the symptoms of hoarding were recognized, but it was thought that they were really a possible expression of obsessive compulsive disorder, OCD, or perhaps related to psychosis. In some cases, we see people speculated that they may be connected to obsessive compulsive personality disorder, OCPD. One of the symptoms for that disorder is an inability to throw out worthless items. So we see a bit of a connection there. Now, the criteria for hoarding disorder in DSM-5 is fairly straightforward. We see a persistent difficulty discarding possessions, regardless of their value. The difficulty is due to a perceived need to save the items or to distress associated with discarding the items. The difficulty results in the accumulation of possessions, and that causes congestion in living areas. Now, there's an exception with this particular criterion. If like relatives come in and clean out somebody's house, they could still meet this criterion, right? So if they had not intervened, would the house be cluttered? Next, we see clinically significant distress. So if somebody accumulates a lot of items and it doesn't cause them dysfunction, it's not a disorder. We see the difficulty can't be better explained by a medical condition or better explained by another mental disorder like OCD, major depressive disorder, or schizophrenia. About 85% of individuals with the disorder are eligible for a specifier called excessive acquisition. So a specifier modifies the primary diagnosis, right? So it would be hoarding disorder with excessive acquisition if somebody had that. It's most commonly seen in the form of buying. Next, we would see acquiring free items, and sometimes we see stealing, but this is fairly uncommon. There are some other specifiers as well for hoarding disorder, and all of them have to do with insight. Better insight is associated with a better prognosis. So looking at these three specifiers, we see with good or fair insight. So the person recognizes that the hoarding related beliefs and behaviors are problematic. Then we have with poor insight. So the person mostly believes that the beliefs or behaviors are not problematic. And then we see with absent insight, delusional beliefs. So the person is completely convinced the hoarding related behaviors are not problematic. So now taking a look at some other characteristics of hoarding disorder that kind of tie to this particular case that I'm looking at. We see that perfectionism, avoidance, being disorganized, procrastinating, being highly distractible, and indecisiveness are all tied to hoarding disorder, which of course is an interesting mix of characteristics. Perfectionism is associated with high conscientiousness. If you're indecisive and disorganized, that would be associated with low conscientiousness. So we see kind of.
How does that make sense? Perfectionism and hoarding. I mean,
Yeah,
clearly,
it's kind of
I
an
mean, that's,
oxymoron.
yeah, it is an oxymoron because you're like, now, how can you be a perfectionist and then hoard up your house?
Right.
I know he's going to explain this to us, but I think that's just so wild that you can have both of those, that they can both be true at the same time.
Right.
That's just
crazy.
wild. It is crazy. Here we go. Let's listen. He's interesting, though.
Kind of splitting that trait. We see that high extroversion is related to hoarding disorder, which is somewhat surprising. We would tend to think there would be really no association with extroversion, and high neuroticism is associated with the disorder, and this part isn't really surprising at all. Someone over the age of 55 is 3 times more likely to have hoarding disorder as compared to somebody between the ages of 34 and 44. Females with hoarding disorder are more likely to seek treatment than males, and females are at a greater risk to have that excessive acquisition, specifically through the buying form, right? So the excessive acquisition specifier, and the acquisition is through excessive buying. Also, we see that individuals with this disorder tend to live alone. Now, this one's not really clear in terms of why this is the case. My thinking is that if somebody has these tendencies and they happen to live alone, there's a greater chance that those symptoms would manifest. If they live with somebody else, that other person might prevent the acquisition of items, right? So that might explain this association between living alone and the disorder. So this case study was published in 2001, and even though the DSM-4 text revision came out in 2000, my guess is the events in this case study took place before 2000, which is why they used DSM-4 in the case report. DSM-4 was published in 1994. Even going back this far, many theorists considered hoarding behavior to be indicative of a separate syndrome. It was typically referred to as compulsive hoarding. So now taking a look at this particular case. The client in this case was a 72-year-old divorced Caucasian female. I will refer to her as Tracy. Tracy was initially encountered when she was referred to an outpatient group for women. At intake, she presented with symptoms of depression, memory problems, difficulty concentrating, and trouble finding the right words. A neuropsychological assessment was conducted, but no evidence of dementia or a neurological problem was identified. The symptoms were attributed to the depression and anxiety she was experiencing. Tracy worked part-time as a sales clerk and lived independently in her own home. She described herself as a pack rat, but did not elaborate beyond that initially. As I mentioned, Tracy was divorced. Her marriage lasted 15 years, and she had 2 daughters from that marriage. Her husband was physically and emotionally abusive. Tracy reported that she started drinking alcohol to manage her feelings, and she became addicted. She went to Alcoholics Anonymous for several years after her divorce and stayed sober for more than 2 decades. Her relationship with her daughters was damaged because of her alcohol use.
Now think about that for a second. Because, okay, so she got sober, right? She stayed sober for so many years. But I bet you in the meantime, she was self-medicating with hoarding and the shopping and all that stuff. What do you think, Sprinkle?
Mm-hmm. Yeah.
It makes sense,
No, I agree.
right?
I agree.
I never thought about it like this. I never thought about these people. It's interesting to learn these things because,
Mm-hmm.
you know, okay, so she was complete, and women over 55 are more apt to do this than anybody else. You got to think why.
That's
But
crazy.
I bet most of them are divorced too, because I would think that if
Yeah.
you're married and in a happy relationship, your partner's not going to let you hoard the house up. They're not going to let this get out of
Yeah.
control, right? Now we've seen
Right.
married couples on that show that did, and we saw how they were, and one man just gave up, and she, you know,
Yeah.
but that's not the norm. I don't think that's the typical for this.
No, I agree.
So, wow, it's interesting. Here we go.
Tracy had 2 main stressors on her mind at the time of intake. Her younger daughter's marriage was coming up, and she was anxious about seeing her ex-husband at the wedding. That stressor resolved through the group therapy that she was receiving. The second stressor was her experience of loss when her eldest daughter, son-in-law, and grandchildren moved to another state. Her daughter had invited them to move out with her and reside in a nearby senior living community. Tracy felt she couldn't do that because she was trapped in her home by all of her possessions. So we see here that Tracy actually asks for help at this point with compulsive hoarding, which she had been struggling with for 10 years. It's worth noting that she did not meet the criteria for OCD or OCPD, stressing the importance of hoarding disorder as a separate diagnosis, which again would become available in DSM-5. Fortunately, these counselors recognized Tracy's needs even without the diagnosis being available in DSM-4. Now, typically, if somebody has OCD and they manifest hoarding behavior, the behavior is highly distressing to them. They're not satisfied with it. There's no pleasure in it. And excessive acquisition is usually absent. So the clinical picture is a lot different when we see OCD. Even still, 20% of individuals with hoarding disorder meet the full criteria for OCD. So OCD and hoarding disorder can be comorbid. Now, Tracy's behavior was satisfying to her. However, it was associated with a lot of shame. We see that she didn't ask for help until she had been in group therapy for 12 weeks and individual therapy for 6 weeks. So it took her a while to talk about this subject. Tracy had collected a wide variety of items in her home, including furniture, kitchenware, paperwork, books, figurines, and clothing. She considered many of the items to be sentimental. So as she was thinking about one particular item, that might bring back memories associated with when she obtained it or when she used it. Tracy would go shopping when she felt down or lonely and would buy a large quantity of items, even though she didn't need them. So Tracy's goal was really around that second stressor I talked about. As I mentioned, the first one had resolved. So her goal was to clean out her house, sell it, and then move to where her eldest daughter lived. So the next stage in terms of treatment here was the intervention, which is fairly common with hoarding disorder. One of the keys, of course, with the intervention is having permission to carry it out. Many people with this disorder will not permit an intervention, right? Because at this stage, people are coming into the house and clearing out all the stuff. So just the fact that Tracy agreed to the intervention was a good sign that she would recover. The agency took a proactive approach and also tried to maintain Tracy's sense of personal empowerment. They indicated to her that she was in charge of how the cleaning of the house took place. She would be supported throughout the process, and agency staff would be active participants in the physical work of identifying and discarding items. Now, when I read this in the case report, I was thinking, not many agencies would allow their staff to participate in the actual cleaning part, right? So I know this took place a while ago. Perhaps it was a bit more common to do this back then, but even still, I was surprised by this part a little bit. Another important point, the intervention isn't the only aspect of treatment. We see that a client can allow an agency to clean out their house, but that doesn't mean the underlying reasons for the hoarding behavior have been addressed. As the agency staff prepared for the intervention, they first wanted to determine if there had been any prior attempts to remove the clutter and to what extent Tracy's house was cluttered. This was a smart move, not just rushing in and trying to clean things out, but rather taking a step back and trying to identify obstacles and figure out the extent of the problem. As far as prior attempts had been made, but they had failed. You
know why they failed? Because she didn't really get the mental help that she needed in the first place. Or, let me ask you this question, or does it always fail as long as they live in the same home?
Yeah, that's a good point.
I mean, that's something we don't know because we've not seen anybody talk about that part of it. But I would think that if you were still in the same, because basically they're in the same situation, they're still depressed, they're still alone, they're still living now, but now they're even more unhappy because they're living in a house that's messed up and they cannot afford to fix it. In most cases, they can't afford to fix it. And it's just almost like, one more thing happened and it's going to be condemned. Because remember in the show Hoarders, these people would have no running water, or their stove, they had no gas, or all these different things were going on, and they were just barely surviving in this house. They clean them out and they find these big holes and all these other things that need to be fixed, but the people were still living there, which is what I find shocking, because I don't see how that helped them, really.
Yeah.
I always wondered about that. But I realize that at the condition those homes are in, even if they own them outright, then try to sell that property in the condition it's in, you're not going to get anything for them, because the house would need to be torn down.
No.
So it's like
exactly.
Yeah, it's like this catch-22 thing that happens where they're damned if they do and damned if they don't.
Right.
It's sad. It's very sad. Here we go.
Only led to frustration and anxiety. Looking at the extent of the clutter, about 75% of the space was occupied by clutter. There was only enough space for one person at the kitchen table and one person on the sofa. Tracy had piles of newspapers, magazines, knickknacks, plates, glasses, old toys, books, boxes, and furniture. Some of those items I talked about before. There were items in just about every room in the house. 2 bedrooms were used only to store items. Most of the windows were completely or partially blocked. There were narrow pathways available to walk throughout the house. This is actually pretty common with hoarding. I've seen this a few times. This can also be quite dangerous. Outside of the obvious risk of fire, there are tripping hazards, and I've even heard of situations where people were trapped by an avalanche of items like books or newspapers. So really quite frightening. They found 5-year-old Easter baskets that she had purchased that still had wrapped candy in them. Another one.
Think about that. 5-year-old Easter baskets that still had wrapped candy in it.
I'm surprised it wasn't older, honestly.
Right? There had to be rats and stuff living in there too.
Oh.
Think about that. I know it's kind of disgusting, and this is not for everybody, and trigger warning on that part, but this is just the reality of this situation with these people. I mean, again, it's the dirty little secret hidden behind the closed doors because it is not talked about. It's just not talked about in those families. Now, I don't think anybody's going to come up to us and say, oh, hey, you know what? My grandma was a hoarder, and let me tell you about it. They're not going to tell us about that because it's embarrassing for everybody involved, the family members, the people doing it. It's embarrassing for all of them.
The shame must just be incredible.
I think so. But, and here's the thing, this yourself. Every time you have been married and divorced, you go through a grieving process because it's like something has died. It is exactly like that because the once life that you thought you had is now gone. Now, sometimes it's your fault, sometimes it's not your fault, but that doesn't matter. It still happens that way. So if you've got a person who's been divorced a couple of times, let's say they've lost a child, they've been alienated from all of their other families who've moved on to other places, and they don't come back to visit because they know that these people are living in this hoard. It just gets bigger and deeper and deeper, and it's no wonder. It's just no wonder that they're like this. I mean, if you think about all the traumatic things that can happen to people, after being married for 30 years, you get a divorce. You know what that does to a woman or a man? Well, men typically move on. It's easier for them, but for women, it's you just can't move on that quickly like that. You're usually devastated financially, physically, mentally. Anyway, it's bad, very bad.
One of the risks we see here, food going bad. The walls in one of the bedrooms had damage consistent with small rodents, right? So actually we see quite a few hazards with this behavior. After this assessment, the agency staff started with the planning stage. They talked about the option of donating and recycling some of the items, which I think is much more acceptable to people most of the time than just throwing something out, because it feels like there's some sort of good that comes out of it. Like all the behavior wasn't just for nothing. Tracy struggled during this stage. She had difficulty deciding what would be thrown out. She also had difficulty knowing where to start. This is also fairly common, but not just with hoarding behavior. When we see any situation that potentially involves an overwhelming amount of change, people just don't know where to make the first step. They don't know what to do to get the ball rolling. So this is where the counselors can really help in terms of kind of pointing out the first step. Now, Tracy did some role playing with the counselors. They went through some scenarios where they might disagree on a particular item that was being considered for removal. They wanted to set an expectation that this would be a difficult process with tough decisions. But ultimately, Tracy was in charge, right? So that's the tone that they were setting here. I think this was another smart move, setting the expectation that there would be some arguments back and forth. It wasn't going to be all happy, right? There was going to be some struggle here. There was going to be a debate. And that process was okay, right? They really normalized disagreeing and having that debate. After this, they had to get to the actual removal of the items. The team comprised her individual counselor, her group counselor, another counselor from the agency, and Tracy's case manager. When the team arrived, Tracy had already marked some clothing for donation. The clothes had tags on them, and they'd never been worn. I've seen this several times as well. You'll see these closets full of clothes with the tags on them. They're really in perfect condition unless there's been some sort of damage caused by water or creatures or something like that. But typically you'll see just all the clothes lined up, the tags on them, and it just seems like such a waste. They were purchased and never used at all. It's almost like they're just there for a sense of security, like the person has another outfit to wear if they need it, but they never go ahead and do that. Another behavior I've seen that wasn't really talked about in this case report is individuals buying multiple sets of the same type of clothing, right? So if it's a particular shirt or a dress, they'll buy several of that shirt or several of that dress and only wear one. Almost like, again, they want to have several backups. So either way, back to Tracy, we see she started designating other items that could be donated and recycled and indicated that she was relieved that the items had some place to go, connecting back to what I said earlier about some good coming from the cleanout. So these items may still have some use. So Tracy was off to a good start, but it wasn't all smooth sailing. She struggled with getting rid of some items, especially where there was some type of emotional connection. Here we see the team took pictures of the different possessions and made a scrapbook. So they were trying to preserve the memory, really honor the emotional connection to the items without actually keeping the items. I thought this was also a clever move. This would have been much easier these days. In the case report, we see they used a Polaroid camera. Nowadays, somebody could use a smartphone, which would be cheaper, easier, and more efficient. Another strategy they used was being open to the possibility that they were making mistakes by throwing out some of the items. This is actually a reasonable assumption, even though most of the items were not useful to Tracy. Invariably, during an intervention like this,
well, think about what he just said there. Buying multiples of the same thing, and and then never wearing them, never taking the tags off of them, never using them.
Yeah.
I can see that happening because they're like, oh, listen, I like this particular style of shirt. Listen, it comes in 4 different colors. But see,
Right.
they're never leaving.
I
They're
do
never
that.
leaving the house. Yeah, yeah.
When I
mean,
see something I like, I buy like black, white. You know, I always buy a couple that I like.
I have shirts like that.
Yeah. Yeah.
Yeah.
That's normal. That's normal behavior.
Except for we leave the house. These people never leave the house because they
Right.
can't.
Right.
For a lot of them, they don't have. Well, now there are some that are professionals that continue to work and all that, but that is not the norm for these people. Most of
No,
them are
it's
like
not.
on that hoarder show, without electricity,
Mhm.
whatever. They can't wash their clothes. They can't, you
You can't
even
shower.
right. You see some of them living in their car because their house is hoarded up. I mean,
I know. It's
that is
crazy.
frightening. That is kind of frightening. I don't know how they. Here's the question: how could you let one of your family members, if you knew it was like this, how could you let them live like that? How could you not intervene and help them? And how
Right.
could you
Before
lay
it
down at
got
night and
so
just,
bad.
yeah, yeah. How could you do that to your family member here? Sad.
Yeah.
People will throw out items that actually would have some use for them in the future. Here they emphasize the ability to rectify any mistakes. If an item was thrown out that she needed, she could replace it at a later date. It was worth taking that risk to get the house cleaned out to meet the ultimate goal. Obviously, this is a harder sell when talking about something that is, in fact, irreplaceable. So when all this was said and done, Tracy had donated, recycled, or discarded 85 boxes of books, 25 bags of clothing, 10 boxes of toys, 10 boxes of collectibles, and more than 20 bags of garbage. That reduced the amount of clutter in the house by half. Now, when I first read that, I was a bit surprised. I thought with all those quantities going out, the reduction would have to be more dramatic than that. But that was just half the clutter. I thought for sure it was going to be something like down to 10%, right? But of course, half is still a significant improvement. As I mentioned before, the intervention with hoarding disorder is not everything. The underlying reasons have to be addressed and the client has to maintain the gains that were made. Well, in this case, due to a restructuring that occurred at the agency, Tracy was actually disconnected from all counseling services. It's not clear from the report if she was referred to another agency or if she declined a referral. Evidently, she still had case management services, and the case manager indicated that within 3 months, Tracy had disposed of the rest of the items and her home was being repaired. 6 months later, she moved into a condominium near her daughter. The new case manager indicated that Tracy was working part-time and was having no significant symptoms of depression or anxiety. Often, when I read these case studies, I look at the treatment that was selected and I think, okay, that was appropriate. Of course, that kind of makes sense. If the people selected the case report, they're going to usually pick situations where their treatment was appropriate. But even still, I usually find a number of things that I would have done differently. With this particular case report, though, I was pretty happy with pretty much all the strategies they used. They were quite clever, and they really thought things out pretty well. I really admire, too, the dedication and the hard work that the counselors and the case manager invested here. Now, of course, these strategies would be unlikely to achieve success with somebody who had a lack of insight. If the client didn't understand that the clutter was interfering with their goal, there would be no reason to remove the clutter. But for somebody with enough insight to appreciate the consequences of the hoarding behavior, I think these treatment strategies really make a lot of sense. I know whenever I review case studies, there will be a variety of opinions. Please put any opinions and thoughts in the comment section. They always generate an interesting dialogue. As always, I hope you found my analysis.
Yeah. That's just they used one example that was an absolute success, but that is few and far between is the way I understand it. I mean, that just is how it works. I mean, I'll tell you what's kind of weird, and this is kind of a little bit off topic, but we always kind of have that problem where it's kind of get off in the weeds and twist a little bit something different. But do you remember Gypsy Rose Blanchard and Dee Dee's house was just a hoarded up mess?
Oh, yeah.
Okay. Remember, I don't know if you remember seeing this or not, but like there's been some little videos that has came out now where somebody had done a FOIA and gotten some videos from her from her home, I guess from for her home, whatever. And it was things, it's like all these little baby clothes just organized so neatly, right? And these little,
Yeah.
think about that right there, the perfection and the hoarded mess. Because I can tell
Yeah.
you, Dee Dee was ill. I know she was not able to keep up with like that, but I know that they were always
Right.
getting things donated to them and all this other stuff. And I think that hoarded up house was a combination of both of those people, to be honest with you.
Oh,
But
absolutely.
I just thought it was weird when I saw the perfection and the hoard in that. But we know she's mentally ill. Let's be honest. We know she is.
Oh, yeah. Oh,
Gypsy
yeah.
Rose Blanchard absolutely is. There's a
Oh,
lot of things wrong with her.
absolutely.
Quit sharing that. Oops, stop. Whoops, hang
Yeah,
on.
and then those new videos that have come out about her are very damaging.
Yeah, they are. And you know what? That's the thing, though. She thought that none of this would ever come out. And I know we're going
Yeah.
on to a different topic, but that's okay. I mean, but I'm glad they are, because we've all known the whole time that what was perpetrated was a damn lie. That she is the mastermind here, and I cannot believe that they did not investigate that case any more than they did, and just gave her that offer.
Right?
She knew she was 24 years old, and she's sitting there telling the cops, well, I'm just 19. I'm just 18, whatever she said she was. She knew how old she was. What kind
She
of
did.
garbage is that,
Right.
Mm.
I agree.
I mean, I'm just like, that case, I know that nothing will ever get done. I know that it is what it is now. That's it. Where are we? Hang on. There we go. Oh, where we both are now. Come on here. I guess I have to put it back like this. Oh Lord, let's see if this will work. I'm gonna make this bigger somehow, but anyway.
Oh, we're back on black screen.
I
Yeah.
know I don't like it, but I don't know how to fix it either. Here we are. Oh, wait a minute. Yes, I can fix it, I think. Well, that doesn't help much, but at least we're both there. At least it gives us something to look at, right? But
Yeah, the little thing is really cute. It's really cute.
oh my goodness. Let me go back over here a minute. So when we were talking about, just hoarding, the hoarding disorder, hoarding disorder is just so under recognized and under treated. And I believe that is a true statement, I believe.
Yeah. And there's so many layers to it. There's so many layers to it.
Through hoarding developments, just like these developed by early adulthood, patients present only later in life. So that, I mean, it's just something that was kind of already there, resulting in research based largely on samples of predominantly older females. Okay, and that's what he kind of talked about. Let me get this over here. While formerly associated with obsessive compulsive disorder, it is now recognized that the individuals with HD or hoarding disorder often have inattention symptoms reminiscent of attention deficit or hyperactivity disorders. Here we've investigated HD in adults with ADHD. The patients in ADHD clinics, okay, so they're using 88 people, reported on ADHD, HD, and OCD related symptoms, and compared with age, gender, and education matched the control, and they're saying N was 90. Findings were assessed independently and online. The UK sample to verify the replication using a dimensional approach was N equals 220. Okay, so we're not going to do all the math, but I mean, they did a full study, and then they, were able to break it down into how many people out of each group presented with each part. So clinically significant hoarding symptoms were found in 20% versus 2%. Wow, that's a lot, isn't it? So 20% had ADHD in the control group, 20%, respectively, with those with hoarding being on average in their 30s and with approximately half being male, so half male, half female. Greater hoarding severity was noted even in the 30s and with approximately half being, okay, let's talk about this. And it goes on to this. Greater hoarding severity was noted in the remaining patients compared with the controlled patients. Inattention was the only significant statistical predicator of hoarding in the severity of the patient. So the ones with the most severe cases actually had the hoarding as well. I mean, had the attention deficit and that together, right? And they were in their this study, which is kind of strange, isn't it? So, it just says that individuals with this hoarding that suffer from excessive clutter and their difficulties in discarding and often excessive accumulation, just causing clinically significant distress or impairment in social and occupational functions. And then it gives this little, Frost and Hart from 1996 wrote about this. Historically, hoarding symptoms were believed to be characteristics of this. So we've talked about this compulsive disorder, and that was this we talked about in 2008. However, this is where it gets weird. However, the majority of these individuals with HD did not demonstrate the key features of OCD. So obsessions of or time-consuming compulsion. So they didn't have that. Consequently, since 2013, HD has been considered a distinct condition with unique phenomenological, psychological, and neurobiological characteristics. So that's talked about in the American Psychiatric Association. And he talked about that it was put into the DSM-4 in 2013. So it is it's chronic with symptoms typically arising by late adolescence and steadily worsening over time, leading to the significant distress and impact on their daily functioning by age 40. That's amazing. With a prevalence of 2.5%, HD has similar rates for males and females. Notably, individuals with HD frequently have poor insight and consequently do not seek help or treatment. Well, yeah, we know that. That's what we just learned that, right? The bulk of hoarding research has drawn patients with OCD, but see, in the DSM-5, they're saying prior to DSM-5, but more recently, the knowledge of HD per se and its treatment is derived from individuals who self-identify. These samples don't bark. I wish they would not bark. These samples are predominantly female. Now, he just talked about that as well, being moreover to be females that are over 50. That's what comes into this next part of this little study that they did. It's kind of interesting. And despite the historic association between those two, as reflected in this research, it also points a link between HD and attention deficit disorder, because they're talking about that link there. But these patients have persistent problems due to the inattention and impulsivity. So it would make sense to me. It makes sense that these people with the most severe cases of that would also show the hoarding tendencies at an earlier age than the later age, which is kind of, I think, what the study was kind of talking about. But
right.
I mean, I would like to. I mean, I don't really know anybody who I could actually just talk to about this who had attention deficit and was a hoarder.
Yeah.
That's a whole new animal, really. I mean, again, it's not talked about. This is never talked about. But
no, it's not at all.
Let me see if I can.
I wonder what the percentage of hoarding. I wonder what the percentage of homes. I wonder. My laptop's not dead. I think I might. Let's see. I'm gonna Google it.
Go ahead, because I want to pull up something over here. Okay. Let's see if anything pulls up here about this. Well, actually, a year ago, there was Dr. John Cruz did a little. Here we go. Hang on a second. I think we're going to watch. What is the link between this? Was 5 years ago, and this was 2 years ago. Let's see. Let's look at the latest one, which is 1 year ago. Okay, and this is Dr. John
Cruz. Hoarding disorder affects 2.6 to 6% of Americans, meaning roughly 1 in 40 people, with higher rates in older adults over 60, and those with anxiety and depression, while a broader survey suggests 50% of Americans have hoarder tendencies, like unusable rooms, indicating may have clutter, but not clinical hoarding disorder. Around 2.6 have diagnosable hoarding disorder, 1 in 40. Up to 6%, 19 million may experience it, and some surveys find up to 50% admit to hoarding behaviors like having unusable rooms.
Damn.
Prevalence is higher, with estimates around 6.2% for those 55 to 95 compared to 2.3% for 33 to 44 years of age.
Isn't that something? It seems like the number's so big, right? It seems extremely high, doesn't it?
I mean, I can kind of agree because working in property management,
Uh-huh.
I do see a lot of residents who I have in the past seen a lot of residents who in first glance look like they're hoarders. I mean, some of them are true hoarders to where yes, they have to be given notices and things like that to correct their behavior because it becomes unsafe. But you'd be surprised how people live. You'd really be surprised how people live.
I
Most
probably
people
would be.
they don't have clean homes. They don't have picked up homes. Most people have, dirty clothes all over the floor, crap everywhere. I don't know. I was never raised in a home like that. My home is not nearly as pristine. I mean, I never saw the whole time I was growing up, I never saw a dirty bathroom, a dirty kitchen, a dirty living area. I never saw any portion of my mom's house dirty, ever. It was always picked up and it was always clean. My apartment is always picked up because I believe that if you put everything where it belongs, it saves you a lot in the long run. But I do have dust. I have dog hair on the floor.
Mm-hmm.
I have things that I live here, so it's
Right.
not pristine. It's not pristine, but
Right.
I don't have crap everywhere. The dirty clothes go in the dirty clothes hamper. Everything has a place. I put everything back. But you'd be surprised the majority of the way people live is not like that. It's not like that at all.
Well, I think, any of us that have dogs realize it is a lot harder to keep your floors clean. Listen to him, because we have dogs. I
Yeah.
wish he would not bark. I'm
My floors
upstairs
aren't
and
my
he's,
floors
yeah,
aren't dirty. I mean, I can walk on my floors in
right.
sock feet and my socks don't turn black, but they do get dog hair on them.
Yeah,
you know.
that's funny. Now,
Yeah.
my big problem is the floor. In fact, when my husband is home, he don't want me mopping the floor because it's a constant problem of mopping the floor. But it's because I have dogs that I'm weird like that. If I was going to have any compulsive behavior, it is mopping the floor. I'll be honest with you, that's what it is. Because I have
Yeah.
dogs, and I know they go outside and run around, whatever. And
Yeah.
I just feel like it's just
Yeah,
a thing I have. So
I sweep I sweep and vacuum twice a day to try
mhm,
to keep the dog hair at
for the
bay.
dogs,
And
right?
I Swiffer. I have a little Swiffer. I
Oh, we
Swiffer
do
like
that.
every
Okay,
other day. I do
right.
it every other day. You know.
So
I don't
I
have a
don't mop on
yard.
the weekends. Yeah.
I have gravel in my little back patio area. So
Hmm.
I don't have like grass and mud. I have gravel back there. So he's not traipsing in mud and things like that. But I would have to just continually be sweeping and mopping to get this dog hair under control. I mean, it's an adopted dog
I
and
know.
it is what it is, but I
Right.
do my best to try to contain it, but it goes everywhere. And if I didn't have the dog, I would still have dust. So
Right.
I can't say that my house is pristine, but you can walk there's not stuff all over the floor and I can't imagine because I'm the type of person that if I'm sitting here and my sink has 3 dishes in it, I can't relax until I get up and go take care of those dishes and either wash them or put them in the dishwasher because I know they're sitting there.
Yes.
It bothers me. Or if
And you
I
never
know like
know. Yeah.
yeah, I know that like my floors need to be really swept because I didn't sweep them yesterday. So of course, as soon as we're done, I'm gonna get up and sweep them and vacuum
Now
them.
that we're done.
But I wouldn't be able to sit here and just do nothing if my house was in disarray. And I suppose people don't understand how my brain works like that, but I also don't understand how people's brains work on the opposite. If you have shit all over your floors and you have dishes piled everywhere, how can you just relax and ignore it? I don't understand that.
Me
I
neither.
can't wrap my head around it. I just can't. I'm a
You
little
know,
bit neurotic on the other way because even if I'm sick, I'll be like, oh God, I gotta get. Even though I live alone, so it's my mess isn't affecting anyone else, but it affects me, and I'll still get up even if I don't feel well, and I'll take care of the dishes or take care of whatever needs to be taken care of so I can rest peacefully.
I get that.
And I just don't understand how these people can just continue to live in that environment unless it's just so overwhelming that they're just like, it doesn't matter what I do, it's not going to make a difference.
But you see, it got overwhelming because they did not take care of it when it happened. That's the thing, though. These people, I guess because we cannot think like they do, there's no way we can, because we don't suffer from the same thing that they suffer from. Are we a little bit crazy? Maybe, sure, whatever. Yeah, okay. But they have a real mental illness, you know. But here's the other thing about this. Our dogs give us great pleasure. So I don't mind cleaning up after them. I really don't. Because I enjoy their company. I love them to death. And I could not, I've always had dogs. My entire life I've had a dog. I just can't, you know, I just need that extra, it's like a comfort for me. So no matter how hard it is to keep up after them, I'm going to do it because that is my dog. I chose it to be here, you know, but these people, they shouldn't even have animals. Now, you know, there are animal hoarders too. And that's the most disgusting type, I think, because you're talking about a living, breathing thing that you are abusing. And I can't even talk about that. It makes me sick.
Yeah. And then these hoarders that do have animals and there's their feces everywhere. And that's a horrible way it's a horrible way for a human to live. And it's a horrible way for an animal to live as well.
It sure is. Oh, don't do that. Okay. It sure is. And I don't understand that either, you know. I just don't, I don't know what can, hang on a second. You know, they see it, right? They have to see it. How can you just step over it? How can you not pick it up?
You have to smell it.
Right. But what's wrong with their nose? Is their nose like all, is their nose messed up?
I mean, I can't stand when my house doesn't smell. Don't get me wrong. My house never smells. But unless my house, I like it to smell clean. I like it to smell like a candle. I like it to smell like a wax melt. If I walk in and my houses or my apartment is just stagnant, I hate that. I'll light a candle. I'll plug in a wax melt. I'll turn something on to make it smell good. I just can't even imagine living like that.
Me neither. I'm gonna play this little bit of this only because it's going over to that. And the way these people describe this is like their nose is dead or something. And they don't, I guess because they've lived in it so long, they don't smell what we smell. But maybe. Let's watch this for a second. Here we go. And this is going to be again A&E in their hoarder show. I'm sorry, this is TLC and this is over in the UK. TLC UK, here we go.
Hey everybody, thank you for coming. Beverly is going to be making all the decisions today, but she has given us some rules that we can work with. Anything that looks like trash or is broken, then you can take it to the dumpster. But most of the stuff that's in the front room area, we'd like to take to this pod, and then we'll have a little bit of space for doing some sorting.
There,
all right, is everybody ready? Yeah!
This is crazy.
Oh my God. A lot to clean up.
I don't even know where to start in there.
What's that?
There's a binder on the shelf that says things I want to buy. It's a big binder.
Oh, wow.
We're finding a little bit of everything. It's surprising, and it's starting to smell in here.
Okay, that fridge, I bought it, and that fridge never worked from day one, and I'm sorry, but I'm going to try to clean it and return it because that was like $100, and I'm not going to just throw it out.
I'm going to try to clean it and return it because that was $100 and I'm not going to throw it out. Hello.
Wow.
Now, that artist
never worked.
Mentally ill. Yeah.
But if it never works, why did you put stuff in it in the first place?
See, to me, that's like somebody making an excuse as to why it's like that because it never worked.
Yeah.
And blah, yeah. I don't
think it never worked. Why would you even begin to use it? That doesn't make any sense.
No, it doesn't make sense. Here we go. It's so bad.
Oh, God.
Yeah, no, can you smell it through that?
When I opened that, it hit me. The smell went right through my mask and everything. It was bad. I don't think she could have returned that fridge.
Do you get it? that the store won't take it back.
But it should have worked.
Well, yeah, but you're not going to be able to prove to them now that these guys will take it now in the dumpsters, or it has to go to equal.
Just throw it.
Okay.
Wow.
Dog poo, cat poo, rotten fruit. We got everything here. I wouldn't be surprised if there's something dead in here. You okay, buddy?
What is that? Something smell. I smell it too.
That's like rotten egg.
Oh my
That's
God.
what that smell is.
I stepped
Oh
on
my
something.
God.
It was an egg, I believe, but just the smell that came from it, it was awful.
Okay, yeah, it can go in the pod for now. Hey, this can go in the pod. Can you stick that in the pod? That stuff can go to like the pod for now.
What is in this thing here? Is this pod?
That goes to the pod.
So far, it's going pretty slowly. I mean, people are moving things, but it's all going in the pod.
Most of the stuff that
Wow.
we're keeping is garbage, and it needs to go, but we can't get that through to her, and all we're doing is creating another hoard outside.
Oh, that's dog stuff. I want to keep that. I'm not going to try to hang on to everything. Oh, I'm not throwing that out.
It's like they can't see the difference when
As
something
work
is good
continues
and not good.
downstairs, two of the officers.
Yeah, you're right. It's like she can't see it. All this dog stuff. I'm
Yeah.
taking it. People like that
Like
don't.
it's-
They don't. Yeah. Mm.
Like it's covered in urine, it's covered in dog feces, and it's covered in this, or it's covered in mold, and they're like, "Oh, I'll clean it." No, it's not usable. Get rid of it. They can't differentiate that line.
I don't think they realize that some things you cannot clean. You know, like
Yeah.
it's anything that's had black mold on it. You're not cleaning that. It's not coming off. It's gone.
No,
It's-
or rat poop and
Rat
rat
feces,
pee and
yeah,
stuff.
yeah.
You
Ugh.
can't clean that stuff, but they don't. They just can't see that.
It's just pathetic, really. But you know, here's the thing. I don't want to name call or anything because I realize it is a mental illness that they're dealing with. I mean,
It's just amazing how your mind can adapt to make excuses to make it okay for you to be in that environment.
look how quickly she made. Look how fast that it came out of her mouth about the refrigerator, just like that. Oh, that's the excuse right there. Boom.
Yeah.
I mean,
It's
she's
like
thinking
your mind just creates these scenarios to make it all okay. It's unbelievable.
It is. Here we go.
Just move upstairs to see what progress they can make there.
Oh my God.
Jesus.
That looks like a nice home
I am
too.
absolutely dumbfounded.
It does look like a nice house. Then you got also, okay, think about this too. Some of these people that have this situation are living in government funded housing, and this is how they're treating it. Well, the rest of us over here are having to pay for our homes and where we live, and you know, it's
Well,
not
in
like-
California, but in California, government funding houses, they do an annual inspection to
Wow.
make sure that this type of stuff is not going on. They do an annual inspection to make sure that the property is livable by the complex, but also that the person is not abusing the home.
I did not know that. I guess not. We don't know what the rules are everywhere, but that's good to know that California does that.
Mm-hmm.
Wow. Yeah.
Right now, I'm like blown
bad.
away. It just shows the level of how ill she really is. I can't imagine anybody doing this to themselves. I honestly don't even think it's safe to be in this house. I really don't. Yeah, we're done. We're done. We're out of here. This house needs to be burned down, like demolished. Wow.
I thought when they said they couldn't clean the upstairs, that was totally ridiculous. They had like suits on and masks, and that was completely ridiculous. I'm just gonna do it myself, so it's like no big deal.
As far as I'm concerned, I do not feel comfortable at all. Cleaning upstairs.
Okay.
That needs a special team.
Training. Okay.
Without proper training with dealing with biological, like that's biohazard. Upstairs, 100%. I would not.
Absolutely. Well, we don't want anybody doing anything that puts them at risk. So I think we'll leave upstairs in the basement for today, and we'll.
He found it looked like some sort of feces, and but just just like the level of it was. I don't think it's human, but it was just so much of it that it was, and it is biohazard. It doesn't matter if it's animal or whatever.
Absolutely.
It is hazard. So, wow.
Oh, could you imagine the smell of that place? Oh my God.
No, I can't. I mean, I'm not going to eat dinner tonight now. Listen, this is our new diet.
There's not enough candles and wax melts in the world to take care of that. Jeez Louise.
No. And he's right. Maybe it does need to be burned down. Think about that. Because even if you rip the carpet out, you still got to paint the wall. You've got to put something in there to kill, that white kilt stuff. They're going to have to use that to kill any odors that are in the walls.
Well, they would have to remove the drywall. They would have to be re-drywalled, and then if it goes into the concrete, then you have to seal the concrete. I mean, because all that smell goes, especially cat urine, that will get into concrete, and you cannot get that smell out.
Can you imagine? No, I don't want to imagine that. Okay, let's see what happens here. Ugh, so bad.
Just focus our energy on the main floor.
If I could make the decision today to take her out of that home, I would. The animals, I would take those too. Like it's just not fit for human animals to live.
Okay, I got my magazines here. I'm getting overwhelmed now because there's too many things, too many people coming to me too many ways. I just need to go through this stuff. Can we just stop for 1 second? I'm getting a headache already.
To help keep Beverly focused, professional organizer Stacey Walker suggests they go outside to regroup.
Okay, one of the things that I think we're running into the problem is that you're trying to sort as we go,
and it's not.
And we just can't. We just
but
can't
I can't throw everything out though.
But we're not.
We don't want you
to keep everything either.
See, look, that is not all garbage that they just got right there.
You gonna go see?
I want to see what's in there. So this is not all garbage. There's no way this is all garbage.
Okay.
See, this is what's going to happen. This is what I was worried about. And I don't want, and my chair, why are you throwing my kitchen chair away? But I mean, that's so Finn's going to ask him not to throw my lamp out.
This is broken.
It's not broken. It's new. I put it together myself, and I'm the one who bent it.
Okay.
It's not broken, though.
We're not trying to hurt you. We're not trying to make it difficult. We're trying to help you. We're here to help.
Now I have to look through all these bags now because now I can't, now I'm upset. So, this is like my favorite ashtray. Oh my God, what are they? Oh my God, see? I'm like, oh. This is what the city did to me. I am furious. They did not respect me. They did not listen to me. They just had their own agenda and they followed it. Think I'm happy? No. Think I'm thrilled? No. I want my house back to the way it was. I want my stuff back. I want my stuff back.
Today there was some drama. I would say lots of drama.
I don't trust anybody now. I don't want anything to do with it, please. I don't want to ever see Curtis again as long as I live. I'm just really upset now.
After we got scalded there, I was a bit offended by that. The only thing that was going through my mind is for the last 8 months, all we've done is help. And for all us to be out there and hear that we're not trusted anymore, I was a bit offended by that.
The city's going to come and take your home. They're going to come take it. That is a bold, aggressive, honest truth. You're going to lose your whole life because you're hanging on to it so tight, and it's garbage. It might not be, it's useful. We don't have the ability for you, really, to go over every single item that we take out. We just don't have the time. We don't have the manpower. And that's what got you in this point to begin with.
And as the day quickly comes to a close, it remains unclear whether enough progress has been made to save Beverly's home.
There's a lot of work left to do. The pod is full of things that
she's saving all of that nasty stuff.
They see value in everything. They see value in everything.
Oh, I bent it myself, she said. No, I don't think she did. I think that's just another quick lie she made up. You know, I mean, good Lord. I'm going to try to speed past some of. Oh, it's almost over. Okay. I bet there's a part 2 to this one. I put it on faster because we're already been on like an hour and 30 minutes. But anyway, let's listen to the rest of it. Golly.
we're going to be debating over.
Yeah.
I would like to get rid of 80%, but I think we'll do really well if we do 50.
We didn't even get to the second floor, to the basement, and the dog feces and mold is still in the house.
Wow. You know they're going to take that. Hang on. You know they're going to take that house.
Oh yeah.
Let me see if there's a second part to that. This team refuses the house that was destroyed by the pet. I'm not going to look at any kind of pet hoarding, but let's see, cat hoarding. I'm not going to look at that one. Oh, just look at these pictures. You know, look at those pictures right there. That ought to tell you how bad it can be, and they just live in it, and they don't even care. I mean, they don't. They just don't care. Oh, God. Okay.
It's so hard to understand.
It is hard to understand, and I mean, I don't ever want to make fun of anybody because I do know it is a sickness. I get that, but I just want to know. We kind of know where it starts now, when it starts, and some of the mental illnesses that go along with it, and how it kind of starts. But
yeah, but the fact that they can't even differentiate between clean and dirty. I mean, that's a very simple. Those are two very simple things.
I believe these are extremes.
Yeah, they can't even differentiate between something that's livable and non-livable, okay, not okay, clean, dirty, beyond repair. They can't. It's like there's no lines that they can see. It's amazing.
You know, here's another thing I've always wanted to know about these people. Did any of these people grow up in a situation where they were never told the words no? Like, did they grow up in some entitled world where they could just do whatever they want to do? And this might have been part of the problem because all of a sudden they're an adult and the people who supported them are not there anymore. And so now they have nobody regulating what they do. So they just do whatever. I mean, I kind of wondered about that too. I mean, I wonder if that's, I just sometimes I think that's part of what happens because if you don't teach your children how to pick up after themselves and how to clean things up, how are you going to expect them to clean it?
Right.
I mean, it's like everything else. It
sounds so simple. It sounds so simple, but it's really not.
Yeah, it's not.
I don't know. I've always kind of been the believer that like it doesn't matter what you do for work. I mean, it doesn't matter. Everybody goes to work, to the job, and most people work hard. To come home to a dirty home, whether you have a mansion or you have a little apartment like I have, to come home to a dirty place is just who wants to do that?
Nobody.
You know, it doesn't cost a lot of money to be clean.
No, it doesn't.
And it makes your life a lot better to be clean and organized and things put away. Like, who wants to come home to that every day? Even if, say, if you work at a gas station and you're a cashier. Not that that's the worst job in the world, but you know, it's a minimal job on the big spectrum of careers, let's say. Nobody wants to go work their shift at the gas station for 8 hours, 10 hours, deal with all the people, and come home to a mess. Wouldn't you rather come home to a house that's picked up, clean, things remotely put away? Wouldn't you rather come home to that than to come home to a mess? Like,
even at the price of cleaning stuff today, baking soda is one of the cheapest things, and it's one of the things that you can use to clean a home with that does not cost very much. So it does not cost a lot of money to clean. No, it doesn't.
And you can go to the Dollar Tree and the 99-cent stores, and they may not be the greatest cleaners, but like you say, baking soda, vinegar, bleach. There's things that are very simple that you can clean up with that don't cost you a fortune. And I've noticed with a lot of these hoarders, the ones that I've seen, like their bathrooms don't work. So they're using diapers and all of that thing, or they're just using the floor. Those are just simple things that, like, how does that happen?
Then you gotta wonder. Do you think that maybe it's something to do with, well, after their water got turned off, they didn't know what to do, so they just stopped doing anything. But then how did their water get turned off? I mean, I don't know. Is it leaks? Is it not paying the bill? We don't know, but there's so much of it.
Yeah.
Oh, God. Terrible. I feel bad. I mean, I do feel bad for them because we do know it's a mental illness. And I know we look at them and we say things like, wow, why don't you know this? Why don't you know this? But then we come back and we think about that it's really because they can't see it. Yeah, which is
It's
sad.
just so hard to wrap your head around. It's just so hard to wrap your head around it. Like, I don't know, like in my car, I don't like to have trash in my car.
No.
So if I happen to go through a drive-through and I get something to eat and I eat in my car, I take my trash out of my car every day. The outside of my car is not always very clean. The inside may need to be vacuumed because of leaves or things like that. But I never have trash in my car. I can't stand it. How hard is it to take a bag of trash and put it in the trash? Rather than, like you say, throw it on the floor. It's not that hard.
Or that whole, the whole bag of trash is just thrown in the laundry room, or it's thrown out on the front porch, or it's thrown, instead of taking it out to the street. I don't.
It's just so hard it's so hard to understand.
It is. It really is. Well, we've been on.
I certainly wouldn't want to be making a car payment and have my car look like these people's homes.
Hell no.
And people's cars look like that, and it's just not only their homes, it's their vehicles too. That's got to be so depressing. It's just got to be so depressing.
I agree. It has to be so depressing. I mean, because you're right. People don't want to be like that. I don't think anybody wants to be like that. It almost leaves you speechless because you don't know how to answer the question, because we cannot think like that. It's so foreign to us.
We cannot wrap our heads around it.
No, I can't. Anyway.
But there's days that I don't feel like doing stuff, and I'm sure there's days that you don't feel like doing stuff. But as an adult, you just have to do it. You have to.
Yes, I do. Nobody else is going to do it but me.
Right? We have to do it, I don't necessarily like scrubbing my bathroom and scrubbing the toilet and mopping the floors, but, as an adult, I have to do it.
Well, for me, I cannot let my husband go work all day long doing this job, dealing with these people, and then come home and the house not be clean. What in the hell did I do all day? What gives me the right to live like the queen over here and not do anything? Right?
Absolutely.
I am the house cleaner. We don't have a house cleaner. I clean this house, right?
Right.
So I just can't. That's how I look at it, like that. Like, I cannot let him come home just shit like that, because I get to stay home, so I can. That's my part. I'm going to do my part, and we're going to keep it like that. So, if I was sick, yes, he would help me, but I'm not sick, so.
But I'm sure there's some days that you don't feel like doing it.
Hell no. Sometimes my back hurts. Sometimes my,
Yeah, but you just don't say, I'm not going to do it today. You can do it.
No, I don't. I just still get up and do it. I just do
exactly. So where's that part of them? Where's that part of their mind that part doesn't click in?
That's what I cannot understand. I mean, I wish I had an answer to that. I wish I knew where to find an answer to that.
A lot of them work. They have to go to work. They have a job to do. When they're at their job, if they have a task that they have to do, they have to do it. Why don't those same things apply in their home?
In their home, right. Then the other question is, how many of these people in this situation are on disability and they don't do anything all day anyway? Because I'm disabled, whatever their excuse is, because they have all kinds of excuses. It's not only mental illness, but you have that part too. You just gotta wonder. I don't.
Right.
I wonder.
Well,
about
I'm sure
it's
broken down. I'm sure a lot of it. I'm sure a lot of hoarding. Some hoarding is created by disability. Some hoarding is created by mental illness. Some hoarding is created by sheer laziness. So there's a lot of, what's the word I'm looking for? It's not just a black and white. There's a lot of gray area to it.
Yeah, that's true. That's true. It's not just one reason or another. Yeah.
So the ones that are disabled, yeah, you can understand it a little bit more. Yes, I can understand. If you can't physically get up and do things, I get it. I get how
Right.
your house can be a mess. And if you're mentally unwell, then what the hell are you doing living on your own in the first place? That you
Yeah.
can't care for yourself. You shouldn't be living alone if you cannot care for yourself.
You know what, though? I think people don't realize they can't care for themselves until, again, it's so bad because it's behind that closed door. And when it's so bad, it's coming out into the yards when people realize, uh-oh, we got a problem here. They just ignore it.
Yeah.
You know, that's what I think people just ignore that. The families ignore that. And so here it is, you know, until all of a sudden Granny ain't got a place to live, her house is condemned. What you gonna do now? You know, which
Right?
we see that. I
Right?
mean, we see that on these shows. It's not none of it's funny. And I'm sure there's ways to help people, but I think the thing is, unless you know it's there, you can't help. But
Right.
people do not, but because it's hidden, people don't say anything. And that's really the sad
Mhm.
part about all this. I wish, you know, I- you just kind of lose your thought about what can I say next, because what can we do?
Yeah.
What can we do to fix it? That's
Right?
the call to action is, what could we do to fix it? I don't
And
know.
if it is truly 30 to 40% of all
Mhm.
households, that's a lot.
That is a
That's a
lot.
lot.
That's more than
One
I would have ever thought, you know.
1 in 20, I mean, that's a lot.
So
So think about all the people you know, and 1 in 20 of those people are living like that. That's a lot of
in your
people.
neighborhood, in your apartment complex, in your subdivision, on your street, if there's 50 houses in the circle that you live, like this, like if you live on a circle and there's 50 houses there, because it's a big loop right behind the gate, and you've got one person out or two people out of that 50 homes that are like that you don't even know it's like that.
Mhm.
You know, that's really because, you know, things like that affect every level of society. It doesn't matter
Oh
whether
yeah.
you're rich, poor, you know, whatever. It's going to affect every level of society. The more money
Mhm.
you have, the bigger the hoarding is. The bigger the hoard's going to be, in my match. That's how I think,
Right.
because you have more disposable income to waste on crap like that.
Right.
But a lot of these people are just, their credit cards are to the hilt. You know, they can't pay the bills anymore. It's outrageous.
Mhm.
They're strapped out for everything. And that's what happens. All of a sudden, the tumble down effect happens, and they're just like, okay, here I am, I'm stuck.
Yeah.
My water's turned off, my gas is turned off, I can't pay my bills. I'm just over here in this house. It's probably, you know, probably got eviction notices on it. But when they come out and see what's going on, they're not going to evict those people out of that house. They're not going to foreclose that mess, because then they're stuck dealing with it. So
Condemnable. It's a lot of them are probably condemnable.
oh yeah. Well, the damage that does, you know, like even in the Hoarder show, you saw where the walls are damaged, the ceiling's damaged, or the roof is damaged. I mean, the walls are bowing out, the housing are falling apart, it's falling through the floor. I mean, you know, it's been, oh my Lord, I can just go on.
Because they've done nothing. They've done nothing to that home for 30 years. I mean, I live in my apartment, and I know I've been here 5 years, and I know all the little maintenance things that I've had to do over the 5 years. So you live in a home, you live in a place for 30, 40, 50 years. That's a lot of little maintenance stuff that you need to do over a period of time. And if none of that's getting done, when something needs to be done, it doesn't get better until you fix it. So
That's
if
right.
you don't fix it, the problem's going to continue to get worse.
Yeah, I mean, I think some of them know, but they're so overwhelmed they don't. Well, because they don't know where to start. It's kind of like, I mean, they're not all people who can't think straight, because I mean, a lot of them can, but then it just gets so overwhelming, you know, that they don't know where, and it's like they don't know where to start, they don't know where to turn, they don't know who to talk to, you know. I mean, imagine imagine kids that grow up in this, and they're sent to
Oh,
school
God.
in the dirty, stinky clothes. And then it's not found out about what's really going on until these kids land in school somewhere, and then CPS is called. And then it's told what's going on over there. That's horrific for those kids. I
Yeah.
mean, they're going to grow up with low self-esteem. I mean, golly,
The
it's just terrible.
bullying, the
Yes, the
bullying, they can't,
bullying. Yes.
the bullying and the antisocial behavior, because it's not like they can have friends over to come hang out and visit and all the little things you do as a child. You can't go to somebody else's house because you smell. They don't want you over
Right.
there. You can't have somebody come to your house because they can't come to your house because there's no room for anything but trash all over the floor. They're isolated. They don't know how to behave in social circles or social circumstances. I mean, it's a huge picture. It's just not isolated to a dirty home. There's so much more involved in it than that.
I mean, it's creating generational hoarding and generational poverty and just generational dysfunction. That's what we
And
call it, generational dysfunction.
And generational trauma.
Yeah, it is trauma. Absolutely. Generational trauma. You're right about that.
Yeah. Yeah.
I mean, I would like to ask somebody that is a hoarder that's lived in this situation. Were your parents hoarder? Were your grandparents hoarders? Did you grow up in this? Was it taught to you? Was it that you didn't know any better, that this is the way you lived it as a child, and so you continued this?
Right.
I mean, what you know?
You would think though, if you lived in that as a child and you finally got out of that, see, in my logical mind, I would say, okay, if I grew up in that environment and I got out and I got my own place, you would think to myself, I would never want to live like that again. I wouldn't allow that to happen.
Right.
So you would do everything in your power to not live like that. But does that really happen?
I don't know. That's the question, isn't it? I'd like to know other people's comments on this. I think what we're going to do is we've been on an hour 151. I wanted to make its own short, so we're going to get off. But let's just leave it like this. If you have comments that you want to make about this, please leave your comments into the comment section, and we can talk about this again. But I just wanted to get it started today. Because we kind of talked about this before and talked about this, but I just wanted to talk about it today. But anyway. Thank you.
Yeah, just get the conversation started.
Get it going. Get the conversation started. Let people tell us what they think. Let people answer the questions that we have, or they can ask us questions. So, with that being said, I hope everybody's having a great day. Take care of yourself out there. Be careful. And what's my famous last word, Sprinkle?
Hug your babies.
That's damn right, because life is short. Think about that. Anyway, thanks for stopping by. If you didn't get to watch it today,
everybody.
Yeah.
Have a good one.
Oh,
all right.
Bye. Okay.
Bye.
Oh, let me see what Elizabeth's saying. In Bamboozles, it was the moon. She's funny.
Oh.
Thank you, Elizabeth. She's always so funny.
Thanks for being here, Elizabeth. Thanks for being here.
Yes, we're gonna get off of here now. Thank you. Y'all have a good day.
Bye.